So thank you very much for inviting me along today. I am here on behalf of the PBM team to talk about the app. It is currently in development, and the app is designed really to be a blood component administration app. It's specifically for paediatric and neonatal patients, so very tailored information. And the idea is really that it's designed to support bedside transfusion practice and supplement local policy, processes, and training. So it can't replace it because it really is a snapshot and précis of that national level guidance and best practice and bringing it all together in one place. So it can't replace it because we know we need that nuance at local level and that detail. But it is there to support and supplement with those core guiding principles of good, safe practice. So the concept behind it and how it's come about is really building on and complementing the success of its sister app. So you may have come across Blood Assist. Blood Assist was launched in 2020, so it's been around a good few years now. And Blood Assist was designed and came into fruition based on shot reports and shot data. So, it was a few years in the making. So it really focused around the 2017, 2018 reports, which demonstrated high incidence of errors at the bedside, and really focused those recommendations around the importance of bedside checks and that bedside checklist and having a robust process. So the Blood Assist app really focused on adult and was all around those adult guidelines and adult specific requirements, because that was where the majority of the incidents seemed to be occurring. And like I say, the app was launched in 2020, and it so far, from our perspective, it seems to have been well utilised and well received. It was nominated for a Patient Safety Award. It has had countless downloads in terms of the app, and the website continues to get a continuous number of hits and uses year on year since it was launched. So it seems to be well used in practice. There was quite a lot of interest, from within Europe as well. We had lots of conversation, particularly with Spain, wanting to replicate something else. So it really did seem to be fulfilling a need and a demand for it. But obviously, in terms of equality for patient care across England, and to fulfill the needs that we kept capturing on the lessons learned from the launch of Blood Assist was, what about paediatrics and neonatal patients? What about those patients? So here we are now, developing and meeting that need, hopefully, providing that same, easy access, reliable, safe, up-to-date, accurate information at the bedside, at the fingertip. And the real aim of both of the apps, but in particular Baby Blood Assist, is around improving patient safety for our paediatric and neonatal patients, and reducing the impact that those incidents have, both in terms of our time and resource, but also costs associated with those incidents, and really helping to improve staff confidence. So, we know that you're out there doing the training, the education, that there's policies and process, and we can be competent, but not always confident. And sometimes that lack of confidence in itself can be a bit of a barrier to safe patient care. So we're hoping that having this extra tool and this quick access to that national guideline and information just helps build that staff confidence. Now, you could ask, why haven't we just jammed this? Why didn't we do it all in one go? Why didn't we just put it all in one app? But really, if we're thinking about what we're trying to achieve with the app, is that ease of access and that quick, usage and ease, which the more information you put into an app, the more things you've got to click, the more things you've got to scroll through to find the information that you want. And suddenly then you're losing the thing that makes the app useful and makes it, I think, a bit of a success. So by keeping them separate, we keep that functionality, we keep that quick, ready access. It also makes it easier to maintain that information as well, having them separate, but it also maintains safety. So there's a lot of work going on to make sure that it's very clear which part and which bit of the guideline you're in, which app you're in as well, to make sure that you know what you're looking at and when you're looking at it. So a quick run through of what the content and what's going to be in the app. Now, these are some very early design images of the build, and they haven't been shared outside of the PBM team yet. So you are getting a sneak preview, special treatment. And as you can see, there's going to be two very clearly defined branches here, the neonatal and the pediatric branch. And we're going to use things like images and colours to make sure it's really, really obvious where you are, and have that visual impact to make sure you know which element you're in. And they really do mirror Blood Assist in terms of content. So it is that very, very focused approach on bedside transfusion practice. And there is also that signpost that if your patient is over 18, access the Blood Assist app, the adult version of the app. And concurrently to this build and the development that we're doing with Baby Blood Assist, we're retrospectively going back to the original app to make sure that same visualization, that same differentiation and labeling is there so that people are really clear they're in the adult version. So what the app's going to cover for both neonatal patients and pediatric patients is positive patient identification, consent, that bedside checking process, specific requirements, compatibility, the administration steps and process, and then guidance for transfusion reactions. So in terms of development, we've had a really amazing core group of patient blood management practitioners. I'm sure many of you will know them. So we've had Danny Gaskin, Charlotte Longhorn, and Joe Bark helping to deliver this, as well as some amazing support from our educational support administrator, who's been brilliant at keeping us on track and making sure we dot all the I's and cross all the T's. And as well as that, we've engaged with various subject matter experts and those of you out in practice from across England, so that we make sure that we're getting that kind of regional view and that whole kind of NHS England picture. As well as trying to make sure that, as well as engaging with specialists in specialist paediatric trusts like Gosh and Alderhay, that we also look at more generalised hospitals that provide paediatric and neonatal care to make sure that this app really is, and the content within it is designed to meet everybody's needs and support anybody who is needing to transfuse a paediatric or neonatal patient. We've been able to secure through our procurement process the developer that we worked with for Blood Assist, which has been amazingly helpful, because we can build on top of that very robust digital code. It's all way beyond my technical expertise, but because we have that structure and we know that it's well tested and well used, it gives us that kind of advantage, as well as, you know, the fact that they know, and the NHS standards and NHSBT quality requirements. So it's had a massive benefit for, working on Baby Blood Assist and delivering Baby Blood Assist. And then we'll still have a really robust quality plan and user experience testing. So for Blood Assist, it was run as a pilot in one specific trust. For Baby Blood Assist, we really want to engage again across England and across the different kind of areas and specialties to make sure that we get that real wide user experience feedback. And I should mention as well that we've had amazing clinical lead support from Anne Kelly, who you've heard from today in regards to the BSH updates. So that's meant that with the content development, we've been able to be as up to date and accurate as we can possibly be. So where are we up to? So the content is all authored and agreed. And when I wrote these slides, the build was in progress, but we have actually just had the first draft of the build, which is really, really exciting. So this means now that we're moving on to that testing and getting ready to do all of that really robust quality testing and get that user experience and engagement before we go live. So the next steps for us really are to get that testing complete, to get everything signed off, to get the feedback from users and finalise and make any tweaks and adjustments we need to. Get ready for it going live. So the launch, which at the moment we're aiming and we're on track for that to be early in 2026, so early in the new year. And we will keep updating you and communicating with you, when it's coming and where it will be. It will be available on all Android and Apple stores, app stores, as well as, all of the main web browsers. And then it doesn't really stop there for us as a team. It really will be important to collect your feedback, your experiences, any problems, issues, what you like, what you don't like, but also capture those lessons learned from the process and the development process. This is a very, very specific app with a very specific scope, which is that bedside administration and that bedside practice. But there's so much more that we could have put in here. There's so much more to transfusion. So, we want to capture that, and we want to capture what that need is, and we want your feedback as well, because it does shape where we go next, and how we keep working to support you. Hence why we've got Baby Blood Assist. It's very much based on those lessons learned, what we couldn't fit into the original app, and all of your feedback saying, what about our paediatric and neonatal patients? So we are, that's why we're here. So that feedback and those lessons learned are really important.